You've probably seen mini tummy tucks online and thought, hey, that's exactly what I need. But what if I told you that less than 10% of people actually qualify for one? Hi, I'm Dr. Shim Ching, board certified plastic surgeon here in Hawaii. Today, I want to talk to you about something that comes up all the time in my consultations, the mini tummy tuck. What is it? Who's a good candidate? And why can't everyone have one? There's a lot of misunderstanding about this procedure. Many patients come in and ask, can I have a mini tummy tuck instead of a full one because it's smaller, faster, and has an easier recovery. And while that's true in some cases, the reality is that most patients actually aren't candidates for it. So in this video, I'll walk you through exactly what a mini tummy tuck is, how it differs from a full tummy tuck, who qualifies for it, and what kind of results you can expect, and why it's only right for a small percentage of people. A mini tummy tuck is a variation of the standard abdominoplasty or full tummy tuck. It's designed for patients who have a very specific type of concern, usually people who already are very slim, have very little excess skin, and primarily have looseness or stretching in the lower part of the abdomen where the muscles stretch apart. In my practice, I perform both full and mini tummy tucks, but the mini is far less common. Probably less than 10% of my patients qualify for it, and there's really a good reason why. Let's start by talking about what the mini tummy tuck actually involves. Surgery is similar in concept to a full tummy tuck. We're tightening abdominal muscles, improving contour of the lower stomach, but the incision is much shorter. Usually it's just a little bit longer than a C-section scar, maybe about this long at the most across the abdomen. Through that incision, I can tighten the muscle layer, remove a small amount of skin, typically just a thin strip at the bottom of the abdomen. In some cases, I'll do a small amount of liposuction at the same time to get better contour. Because the incision is shorter, the area of skin I can lift and remove is also much smaller. So it's not possible to address large amounts of loose skin and fat with this approach. And that's the main reason why people don't qualify for this. They simply have too much extra skin or looseness to get a meaningful result from mini tummy tuck. So who is a good candidate for this? Usually these are patients who are in good shape, maybe very fit, but after having children, they notice their abdomen looks a little rounder, protrudes when they're not flexing. This is what we call muscle laxity or separation of the abdominal wall. Muscles that were stretched during pregnancy don't come back fully together, and that gives the abdomen a fuller appearance. If you're that type of patient, very little fat, minimal loose skin, but that persistent roundness, you may be a good candidate for a mini tummy tuck. The mini allows me to go through a small incision, repair those muscles all the way up the abdomen, remove just a small portion of skin at the bottom. Usually we don't need to rebuild the belly button in this procedure because we're not removing the large area of skin. What we do instead is what's called floating the belly button. This means I temporarily detach it from the muscle layer underneath, do the tightening, then retach it slightly lower. Result is a natural look without having to make a new belly button. Because the incision is shorter, we're removing less skin. Recovery is a little bit quicker, scar is smaller, patients can return to light activity within a week or so and full activity in a few weeks. But it's important to understand this is still real surgery. It's not a shortcut. You're still tightening the muscle layer, and that part of recovery feels very similar to a full tummy tuck. You'll still have some soreness, tightness in your core for the first couple of weeks. So while the incision is shorter, it's not necessarily a dramatically easier recovery. The difference is mainly how much skin is removed and how much contour change we can achieve. Now let's talk about who isn't a good candidate for this. If you have a lot of loose skin that you can pinch and grab above your belly button, if you have stretch marks or sagging skin across the middle or lower abdomen, or if you had significant weight changes, you're probably going to need a full tummy tuck. A mini tummy tuck simply won't address those things. Incision isn't long enough to lift and tighten. If we tried to do this with small incision, results you would see would be very limited. You might still have a lot of loose skin, and that's not what we want. That's why in most cases, a full tummy tuck gives the best, most natural looking result. It allows me to remove all the skin from the abdomen, reposition the belly button, and smooth everything out evenly. The scar from a full tummy tuck is longer, yes. It runs hip to hip, but it's placed low so that it can be covered up by underwear or a bikini. And for most patients, that trade-off between scar and result is well worth the result that they get. I know a lot of people hope to be candidates for a mini tummy tuck because it sounds easier. And if you're somebody who only needs a minimum amount of tightening, not that much loose skin, it could be a great option for you. But if you have a lot of skin looseness, that mini tummy tuck probably isn't going to be the answer for you. The key is to match the procedure to the problem. Trying to make a mini tummy tuck work on somebody who really needs a full one will only lead to their disappointment. Results will be incomplete and the skin of the abdomen will still look loose. During consultations, I always evaluate patients carefully. I have them slightly bend, sit, stand, move, so I can see exactly where the skin laxity is and how much needs to be removed. If it's truly limited to lower abdomen, then a mini might make sense, but if it extends higher, a full tummy tuck will usually be the right solution. Sometimes I'll combine a mini tummy tuck with liposuction if the main issue is a little extra fat and some mild lower skin looseness. But that's case by case. I also want to touch on the belly button position again because this surprises a lot of people. In a full tummy tuck, we make a new belly button or rebuild the old one because we're removing a large amount of skin, lifting it all the way up. In a mini, we don't. We just release and reattach and lower down. This means your belly button will sit slightly lower after mini tummy tuck. It still looks natural, but it's one of the small differences patients notice when comparing the two procedures. Recovery from a mini tummy tuck usually involves about 1 week off work for desk jobs, maybe 2 or more for physical work. You'll still wear a compression garment, just like a full, and you'll want to avoid any core exercises for about 2 months until the muscle has fully healed. Swelling and tightness will be there at first, but typically subsides faster than with a full procedure because the area of dissection, the amount of skin that's lifted, is smaller. As with all surgeries, results will take time. You'll see improvement right away, but the final shape will continue to refine over several months. If you're considering this procedure, the most important step is getting an honest consultation with a board-certified plastic surgeon who performs both full and mini tummy tucks. They'll be able to assess your anatomy, your skin elasticity, your goals, and tell you realistically which approach will give you the best result. In my practice, when patients come in hoping for a mini, I always explain the pros and cons of both options. My goal isn't to steer anyone towards a bigger surgery, it's to help them get the result that matches their goals and their body type. For the small group of patients who are ideal candidates, a mini tummy tuck can be a fantastic procedure. Smaller incision, faster recovery, and a nice natural tightening of the lower abdomen. But for the majority of patients, a full tummy tuck is the better choice because it truly reshapes the entire area. At the end of the day, what matters most is achieving a balanced, natural-looking result that restores confidence and your comfort. If you found this video helpful, be sure to watch my other videos where I talk in detail about recovery, pain management, and what to expect before and after a full tummy tuck. I'm Dr. Shim Ching, board-certified plastic surgeon in Honolulu, Hawaii. Thanks so much for watching, and I'll see you in the next video.